Dear PW students, welcome to our Wednesday and Thursday Pediatric Clinic session. Today we are going to discuss about an important aspect, abnormal facies. Is it possible to identify certain diseases based on looking into the face of any child? The answer is yes. So what are all the abnormal facies that can be kept in your Viva OC or that can be asked in your NEET or your next examination pattern? That is what we are going to see right now. Let's go to the first image. What is this image? It is a telltale evidence. Yes, very good. You are dealing with a case of Down syndrome. Very good. You are dealing with a case of Down syndrome. 1 second. Just a second. Let me share that video. 1 second. So we are going to look into these images, and these images are going to give the perfect diagnosis. What does this face is called as? Yes, you are correct. This is nothing but Down's facies. What are all the features of Down's facies? They have small ear. They have small nose. They have small ear, nose as well as mouth. Apart from that, they have flat nose. They have flat facial profile. Flat facial profile. That is otherwise called as anteroposterior diameter of their faces is very flat. That is called as brachycephaly. That is called as what? Brachycephaly. That is called as brachycephaly. And then look at this. And then you can have, what is this? Epicanthal folds. Epicanthal fold. Then comes here. Look at this. Normally this is medial canthus. This is lateral canthus. The medial canthus and lateral canthus should be in a straight line, but look at this, the lateral canthus is upward compared to the, lifted up compared to the medial canthus. This is called as, okay, so this is called, what is this? The outer canthus is lifted above, okay, outer canthus is lifted above. Is lifted above. This is called upslanting of eyes. What is this called as? This is called as upslanting of eyes. This is called as upslanting of eyes. So you have flat facial profile, flat nose, and also one more point, protruded tongue. You have protruded tongue. Right? Flat nose, flat facial profile, brachycephaly, dysplastic small ears. Sometimes dysplastic small ears. Yes. Okay. Right. This is with respect to Down's faces. Let us go to the next face. Look at this. You can see umbilical hernia. That is an important clue. What else you can have? That is an important clue. What else you can see in this picture? The child is crying, and look at this, puffy eyelids. So what is this? This is a newborn with puffy eyelids. So this is a newborn with puffy eyelids. Whenever you see a newborn with the puffy eyelids along with protruded tongue, what is that? along with protruded tongue. Newborn with the puffy eyelids and protruded tongue. Another clue is umbilical hernia. Another clue is umbilical hernia. And also the mentation will be poor. The child will be lethargic, inactive, despite absence of sepsis. In newborn, whenever we speak about lethargy and reduced movements, you need to think in terms of sepsis. But one other diagnosis which mimics clinical sepsis, but there is no microbiological evidence of sepsis, is your hypothyroidism. So this is a newborn with hypothyroidism. So what is this case? This is a newborn with hypothyroidism. Okay, this is the newborn with the hypothyroidism. Puffy eyelids, protruded tongue, umbilical hernia, lethargic, okay, and also hypothermia can also be there. Hypothermia can also be there. Can also be there. So this is nothing but a cretin, or otherwise known as congenital hypothyroidism. Remember, for a pediatrician, any newborn with the protruded tongue and puffy eyelids along with the subnormal temperature is sepsis, is neonatal hypothyroidism unless otherwise proved. So this is with respect to congenital hypothyroidism. This case is congenital hypothyroidism. Next, look at this. He very emaciated. What he is suffering from? So this child is emaciated. This child is emaciated. And look at this. Only skin and bones. Only skin and bones. One is emaciated. Second one is skin and bones. Look at this. Absence of subcutaneous fat. Absence of subcutaneous fat. As a result of which he has got monkey faces. As a result of which he has got monkey faces. This monkey faces occurs in a disease called as what? Marasmus, which is mainly due to energy deprived condition, energy deprived status. It is a form of severe acute malnutrition. So marasmus is mainly due to energy deficiency, whereas kwashiorkor is mainly characterized by protein depletion. Both are forms and part and parcel of your severe acute malnutrition. But nowadays we don't call it as marasmus or kwashiorkor. We had combined under severe acute malnutrition. Okay, right. So this is marasmus, monkey faces, typical of protein energy malnutrition. What is this? Yeah, midline cleft lip and cleft palate. Remember what is this? This is midline cleft lip and cleft palate. So this is midline cleft lip as well as cleft palate. Remember, whenever you have here, you can have cleft lip here, laterally you can have, but midline cleft lip you should not have. Midline cleft lip or cleft palate is suggestive of what? Patau syndrome. What is called as Patau syndrome, which is characterized by trisomy. P for puberty. So age 13, trisomy 13. 3 numbers of 13. Usually you need to have 1 chromosome 13 from father and 1 from mother. When you have a triplet of trisomy, it is called Patau syndrome, characterized by midline cleft lip and cleft palate. Characterized by midline cleft lip and cleft palate, and it is also characterized by holoprosencephaly. What is called as holoprosencephaly? It is absence of the cerebral hemisphere to divide into two. What is called holoprosencephaly? Absence of cerebral hemisphere to divide into two. Divide into two. As a result of which the eyes cannot separate. Sometimes they will have a single eye. Sometimes they will have a single eye, that is called cyclopia. That is extreme form of holoprosencephaly. So midline, cleft lip and cleft palate, unless otherwise proved, it is a case of Patau syndrome. Patau syndrome. Then comes your, what is this? Then comes your, what is this? Thick eyebrows. Look at this. He has got thick eyebrows. 1. Protruded tongue. This guy has got protruded tongue. Look at this. Thick lips. Thick lips. And look at this. Coarse faces. Coarse faces. Coarse faces. And then large nose. Large nose. So these points are in favor of a disease called mucopolysaccharidosis. So this is a case of mucopolysaccharidosis. Mucopolysaccharidosis. For you, you can identify this case as a case of Hunter-Bar-Hurler syndrome. This is Hunter-Bar-Hurler syndrome. They are nothing but lysosomal storage disorder. Hunter-Hurler syndrome. They are nothing but lysosomal storage disorder. This is abnormal coarse faces with thick eyebrows, large mouth, large tongue, protruded tongue. Okay, are part and parcel of Hunter-Hurler syndrome. And look at this. This child has got a longitudinal face. This child has got a, look at this. This child, sagging mandible. Look at this. This child has got a sagging mandible. Has got sagging mandible. Okay. And look at this. The mandible cannot hold the weight of the masseter muscle. So this is sagging mandible. And it is, the child's face is vertically oriented. Vertically oriented, and this is called myopathic faces. What is this called as? This is called myopathic faces. Sagging mandible is called as myopathic faces. They will be aligned vertically. This is called myopathic faces. Look at this. What is this? Yeah, very easy. What is this? You can tell the answer. So very simple. The eyes could not close. The eyes cannot close on the right side. There is loss of nasolabial fold. Loss of nasolabial fold. And there is pulling towards the left side. Pulling towards the left side. Which one? Angle of mouth. Look at this. Angle of mouth is pulled to the left side, and this is called right lower motor nerve, 7th nerve palsy. The clue is open eyes could not close, loss of nasolabial fold, and angle of mouth is shifted to left side, pulled to left side, opposite side. This is facial nerve palsy, right side. 7th nerve palsy, right side. Right side. And finally, look at this. Is this facial nerve palsy? Here also, angle of mouth is deviated to left. But look at this. Both eyes can close. Eyes can be closed. Second, there is presence of nasolabial fold. Presence of nasolabial fold. So this is called absence of depressor anguli oris. There is a muscle here which makes the angle of mouth to depress. When angle of depressor anguli oris is absent on one side, the other side will be automatically pulled. So this is the most important differential diagnosis for a child with deviation of angle of mouth. In facial nerve palsy, the opposite side cannot be closed, as well as there will be loss of nasolabial fold. Whereas in case of absence of depressor anguli oris, eyes can be closed and nasolabial fold will be intact. So intact. Okay, right. And what is this? Look at this. The child is having severe eczema. The child is having severe eczema, and because of severe pruritus, majority of areas are thickened, otherwise known as lichenification. One such disease in which you will have severe eczema, one is atopic dermatitis that will respond to steroid creams and emollients. Second one is hyper IgE syndrome. Third one is Wiskott-Aldrich syndrome. Fourth one is Langerhans histiocytosis. Whenever you have intractable pruritus, you need to consider these following differential diagnoses. What is this? Look at this. The child is having, yes, you are correct. The child is having large head, otherwise known as hydrocephalus, congenital hydrocephalus, which is characterized by sunset sign. That is, both cornea will be looking down and both your cornea will be looking down and conjunctiva white will be visible up. This is called sunset sign. And remember, more than 1 centimeter in the first 15 days. Okay, increase in head circumference should be considered for hydrocephalus. Hydrocephalus means accumulation of fluid in the excess accumulation of cerebrospinal fluid in the central nervous system. That is called hydrocephalus. What is this? Look at this. There is periorbital puffiness involving the upper eyelids. So this is periorbital puffiness of upper eyelids, suggestive of renal pathology. The most common cause is renal pathology. The most common cause is nephrotic syndrome, which is characterized by excess protein excretion in urine. Okay. With this, the topic for today is over. Thanks for your